It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, thank you for joining us another health show. Again, very informative. How many of you are traveling out of the country or traveling anywhere? What do you need to know about the areas you're going into? For example, are any diseases there? Do you have to bring any kind of medicine with you? Should you have any shots before you go to these different areas? When I had Dr. Kowalski on my show last time, it was extremely informative because one of you came up to me and said to me that you had called. You were going overseas to a particular country, and you didn't realize that you had to have certain shots and certain things to bring with you. And again, we're going to be talking to Dr. Kowalski today, but also what's on the minds of a lot of people in the news is the Zika virus, the mosquito. So we're going to talk about that today. Hey, Doc, nice to have you on the show again.
Thanks for having me again, Sam.
We learned a lot last time. You know, you doctors really give me a lot of information.
It's always great to talk with you.
Michelle, you're at your occupational health services at the Hazelton Well Center in Hazelton, and from what I understand, from August to 15, you'll be also at Mountaintop, correct?
Yes. Yeah.
Beautiful facility.
Yeah, we're looking forward to opening up our services up there.
Yeah, the latest technology, I think the Lehigh Valley Health Network just went, they always do things first class. Now, tell me a little bit about your professional background.
Well, my specialty is preventative medicine, and that's done mainly within the context of the workplace. We focus on occupational health, but I also do prevention within the community, and then also for people who travel from our community. Traveling abroad presents certain risks that should be addressed before they go. Okay,
so now, that was the interesting thing. Okay, so occupational health, okay, going to the workplace and saying how do you prevent certain things. Give me an example of what that would be.
So in occupational medicine, we have a great opportunity for prevention. I'm from this area, I'm from northeastern Pennsylvania. I grew up here and then went to school, military service, came back to raise kids. So, you know, the people here are great. They're, you know, friendly, fun, family-oriented, but most of all, hardworking. And so we spend a lot of our time at work as a community. So the workplace is a great place to practice prevention. We can address ergonomic risk or environmental risk within, you know, specific to workplaces, but even bigger things like hypertension or diabetes. So I really love preventative medicine and specifically occupational medicine for that reason. And the neat thing is it does also involves so many other areas. Public health, travel. We have a lot of people that travel for work, or even people that just travel on their free time. You know, they want to be healthy to be able to do those things.
So the interesting thing is, okay, so if I have a company and I want you to come in to talk to the company, you know, what do you stress when you talk to any plants or various companies that have a number of people? What do you stress with these people?
So most of all, you know, they want to keep their people happy, healthy, and able to go to work, you know, and be productive and be happy doing it. So we look specific to the company. What are their risks? What does their population look like? Okay. You know, certain jobs, certainly, you know, we have a lot of manufacturing and distribution in our area. That's a lot of lifting or, you know, moving things. So that presents certain ergonomic risks, and our whole team addresses that really well with, you know, modifying workstations to make it less risky. Then even more general things. You know, you may have a lot of people that have problems with diabetes, or a lot of smokers in your population, so we can help address that. So it's really specific to the companies.
I wrote that down specific. The interesting thing would be this: so if you come to the company, okay, and I have employees, do you have access to their? Sometimes they have health records, particularly if there's jobs that are very important, okay, and they're doing things that could affect people. So let's assume the person who's working whatever has a heart condition or has diabetes or has, you know, do you get specific, you know, so here's Sam Lesante, he has this and this and this, and then you know how to work with that particular person?
To some extent, yes. Certainly the companies themselves look at the workers from a population perspective. So they don't know, you know, for instance, that you, Sam, have certain risks. But
if I have an important job that could be life-threatening or it could hurt somebody, they need to know, do I get convulsions? Do I get seizures? I mean, don't you think these are things that that they should know about?
Yeah, absolutely, and that's where we get involved on a more personal level. The company certainly doesn't want to address that, so we would be
Yes.
the ones
Yes.
to consult with, and then we could individually assess that person and make sure they're safe to do their job, make sure their job won't make them any worse. So that's a lot of what we do is fit for duty, and then modifications where needed.
So the travel medicine part, it's twofold. Number one, it could be in the inner United States. If I'm traveling a lot, for example, if I travel on the airplane and I have to go to California or to Texas or whatever, and I have to spend time overnight and whatever, and I have a health condition. All right. So, do you specifically then discuss the various individual situations when they're traveling? For example, if I have a salesperson or if I have a rep or whatever, and they do a lot of traveling, and let's say they're going to northeastern New England states, or they're going to the southern states, or they're going to the western coast, the west coast. Is there anything that you talk about in those areas?
Yeah, airline travel in and of itself, presents some risks. So certainly, you should check that out before you go.
What should I check out when
our
I'm-
main focus is when you're going abroad. Different countries have risks that can really be at least modified, if not completely prevented, with vaccines or medications. So our main focus in travel medicine is when people are traveling internationally. In fact, in some countries, they're going to require you to show what's called a yellow card to show that you've had the yellow fever vaccine, that you've been safe to enter the country.
So if I'm traveling to Europe, and I'm going to maybe Germany, Italy, France, or if I'm going to the United Arab Republic, if I'm going to Budapest, or if I'm going to the different countries, you specifically know what is available or what they need to have in those particular countries?
Yep, for each country, the CDC goes through on a regular basis and assesses what risks are in that country. So, anyone can access that online, what the CDC is saying about those countries. But the tricky part comes in fitting what is that person going to do when they get there? What is their baseline health? Are they at risk for a particular thing or not? I think the Zika virus has highlighted that. Certainly not a big threat for a lot of us, but for pregnant women it is. Mm-hmm. So we really have to look both at where they're going and also, what their health is before they go, what their activities will be.
And so, Michelle, you have access to all of this information no matter what country they're going to.
Right.
What is the most, I don't say dangerous, but health-wise, what country right now would you think that, you have to be very careful? I know you have to be careful in a lot of countries, but I mean, what is the one that, a lot of red flags pop up when you're going to?
That's a tough question. Like you said, different countries have different risks depending upon how you look at it. But some require more vaccines or medicines before you go because of the burden of insects there or other food and water diseases. Certainly the tropical areas come to mind. South America, Africa, those are areas that are slightly more risky in terms of food and water and insects.
How about if I'm going to the Bahamas, or if I'm going to Aruba, if I'm going to Jamaica?
Yeah, even there, food and water can be an issue. Again, it depends upon where you're going.
Yeah.
If you're going to be on a resort the whole time and never leave, then your risk is less than if you're going on a mission trip.
But
or
you
you're
should still
explore.
be aware of what they have or what you can get.
Yeah, absolutely. Yeah.
I think that's very informative. A lot of people just jump on a plane and they go to different countries and assuming that they don't need any kind of shots or anything that they should be aware of. Okay.
Right, that's very true.
Now, when will this yellow card come into play?
If you travel to countries that have a problem with yellow fever, they're going to require that you're vaccinated before you go. Mm-hmm. Because what happens is then if you're not vaccinated, then you could potentially spread the yellow fever. Mm-hmm. And that's how Zika is spreading now. We don't have a vaccine for Zika now, so people that get infected by a mosquito bite with Zika and then travel to a country that may not have it, well now they can spread it to that country. So that's where the yellow card was instituted.
Before we get to the Zika virus and the concerns about that, is there any data that we have in the United States today where there are areas of certain illnesses that were brought over from different countries?
The Zika virus itself, I know you said we're going to talk about
Okay.
that, but that's an interesting case study, if you were, because it really was not in many countries prior to the last couple of years. They found it way back in 1947 in like a forest in Africa. They saw some humans got it. Then they just saw it on certain islands. And then for whatever reason, we think it's probably increased travel, it spread to the Western Hemisphere. It was shortly after the Brazil World Cup of Soccer that they noticed a big jump in the number of people that had Zika, and then problems
The
with
reason
it.
I said, because that's for pregnant women, okay? Does it affect men?
It does.
Okay, well, all right. So there's any other diseases that could have been brought in from different countries without them being checked?
One thing that we are having an issue with now in the United States is measles. Even we've been immunizing kids for years. We didn't really have a lot for a long time, but other countries haven't had that regular immunization program. So measles has been an issue of late. Even in Europe, people don't get immunized, and then they get on a plane and can be brought to the United States, for instance.
So you're seeing a lot of that.
Yeah, more so than usual.
Folks, I'm talking to Dr. Kowalski, Occupational Health Services at the Hazelton and Wellness Center, and also will be at Mountaintop starting August the 15th, you said?
Yep.
Okay. The Zika virus, how does that affect men and women? There's a lot to be said about it. We'll be right back and learn more about it after this break. Welcome back to the Sam Lesante Show. Remember, 24/7, SSPTV.com. You can watch all of our shows, particularly the health shows. My email, sam@ssptv.com. Folks, we're learning today about traveling, what you need to know when you go to different countries, and also what is this Zika virus all about. My guest is Dr. Kowalski, Michelle Kowalski, and you can contact her at 570-501-6600. Doctor, talking about the Zika virus, okay? How has that had an impact on our travels?
I think if anything, it's highlighted the fact that you can't just go, as you said earlier before. You really have to look at where you're going, what the risks are there, what your health status is before you do, so that you can take all necessary precautions. I know when I trained in travel medicine, one of the docs used to say, if I had a vaccine to prevent an airline crash, would you take it? And yeah, of course you would.
Put me down for that.
But a lot of these diseases or problems you see in other countries are even more common than that. So unfortunately, we do have some vaccines and medicines to prevent a lot of them.
What is Zika?
Zika, we don't have a vaccine for yet. They're working hard on it.
Well, what
it's
is
a
it?
virus.
Okay.
It's mainly a threat to pregnant women. Most people that get Zika may not even know it. 4 out of 5 that get it don't even have any symptoms. Maybe they have a little bit of achiness or think they have a cold for a little bit. Only 1 in 5 would get like a viral, maybe a rash or red eyes, some fever. Most people recover without a problem. Pregnant women, though, if they get it while they're pregnant, it can cause anything from miscarriage to deformities in the baby, something called microcephaly, where the babies have like a small head, they have a lot of developmental abnormalities. They think that Zika attacks neural cells. As the nervous system is developing, it attacks what's called the glial cells, and then it just doesn't form correctly. So, we're doing a lot of research on that, but that's the thinking.
If a woman's pregnant, does it make any difference what term she's in and what kind of effect it would have?
Yeah, they're looking at that. They think that the deformities will come more in the first trimester, if she gets infected during the first trimester. And this is where it's such a concern, because a lot of women don't know they're pregnant until, well into the first trimester. If she gets it later in pregnancy, they think it's more likely to cause a miscarriage.
Wow. What can women do then to protect themselves?
Certainly,
especially if you're pregnant.
Know where they're going. The CDC doesn't usually tell you not to go, but it has, all the time I've done travel medicine, I've never really seen where they say don't go, except for when Ebola came around. And now for pregnant women, they're saying there's 49 countries, and that list is growing, where they advise you not to go if you are
Wow.
pregnant or thinking of becoming pregnant.
So it's spread, and I think we're going to show a map as to where it's been. Where is it very prevalent right now? The highest.
Mainly in the tropical areas, South America, the Caribbean, some parts of Polynesia. That's where they're thinking it's most
So
prevalent.
what should you do? What should a woman do who may or may not be pregnant? What should they be?
Right.
How do they prevent this?
And the women that live there too
Yeah.
are certainly of concern. So insect repellent does work. They're saying long sleeves, long pants, insect repellent. Make sure you're protected if you are going to be outside or in an area where there's mosquitoes. Do everything you can to not get bitten. And it's also sexually transmitted, so that's another concern. Even if that pregnant woman doesn't travel to a at-risk country and get bitten by a mosquito, her husband may travel.
So now
and they
it could
can-
also affect men.
Yes, yeah, men can get the virus as well. And
So
again,
you're saying, so here's a real danger that I see. First of all, you said 4 to 5 men, or 4 out of 5 people may have it and don't know that they have it. So
Right.
therefore, if you're traveling and you're in business or whatever, and you get bit by the mosquito, and you're not showing any effects, but you still have the virus.
Right.
It can be transmitted even without you knowing it.
Yes. Yeah, so the CDC has also said, say a man has traveled to a Zika area, even if they don't have symptoms, they shouldn't have sex for 8 weeks afterwards because they can potentially transmit it during that time. If they do have symptoms, they're saying wait 6 months. And certainly condom use as well, because that's a concern. It is asymptomatic, especially in men. So.
Never knew that.
Yeah.
Okay, never knew that. That's where the male factors play. See, if you get some kind of virus, if you're sick, you're sick. Okay, but if you don't know it, and it's like any kind of venereal disease that you pass on, you may not know it until after it happens. Correct?
Right, and Zika causes rash, itchiness, achiness. So many things in the summer can cause that. We see all types of things in summer with rashes and allergies and things like that. So you may not know you've had a virus. You may attribute it to something else.
Lisa and I were talking about this before the show. We talked about the mosquito. Is this a seasonal thing?
They're hoping it is. The Olympics are coming up in Brazil, and it's going to be winter there. So they're hoping that that'll diminish the mosquito population. But with global warming now, we're seeing it even in Pennsylvania, bugs and ticks that, we otherwise would never see during the winter. So it's happening all over the world too. There is less risk in the winter, whether it be in Brazil or here, but there's still always a risk.
So if you're pregnant now, okay, in the summertime, and you're maybe going to the beach or whatever, what do you advise the women to do?
Insect repellent, long sleeves, long pants.
It's difficult on the beach.
Yeah, it is.
But how about the insect? Well, listen, to play safe, it doesn't make any difference what you wear or whatever. But especially if you're pregnant, you have to be extra cautious.
Right. Yeah, and the insect repellent, the DEET appears to be best in concentrations. It's the DEET,
Okay.
Like off, Deepwood's off, or they have a good one now, Ultrathon. People are always concerned about the safety, especially if they're pregnant or on kids. They have said that DEET is safe for pregnant women and kids greater than 2 months old. So, the risk of using that insect repellent is much less than the risk of getting bitten or infected by a mosquito.
Michelle, what if someone, a pregnant woman, is infected with Zika? What should they be doing?
They should be carefully monitored. They're saying that pregnant women should be tested, and then also if they do have it, they're going to do some pretty frequent ultrasounds. Get ready when the baby's born, that there may be abnormalities. Now they're saying even like throughout the baby's lifetime, even if the baby appears normal at first, they don't know if later the baby will have problems. So it's a big issue right now.
It's a serious issue too. So if you're here again, it all depends what trimester you're in, okay?
Right.
Assuming you're, 7th or 8th month, not saying it still may not have effect, but you're saying it may not have as much of effect as if you're in the first trimester.
Correct. Yeah, and some babies with Zika-infected mothers are born again perfectly healthy, we think.
Do you get medicine, or do they take anything when they have the Zika virus if they're detected?
Yeah, unfortunately, we don't have anything yet. The researchers are working very hard on that, specifically a vaccine, because it's not just in certain countries. It's really spreading pretty rapidly. Even there was cases, they're investigating in Miami now too.
I know we showed the map where it was spread. So how many known cases have we as of today of the Zika virus in the country?
There's quite a lot, mainly within our country. It's people that have traveled somewhere else and then came back here. There was really no one that was infected, they think, within the United States until the two in Miami now that they're investigating may have been bitten by a mosquito in the United States and developed it.
So primary transmitting this disease would be getting bit and then coming into the country, other than mosquitoes flying over here. Are there mosquitoes here that can infect you?
There's mosquito types that could get the Zika virus. So yeah, we have the same mosquitoes, type of mosquitoes that they do where they have Zika. So there is a big concern that it could definitely spread here. But nothing has been confirmed as of yet. Certainly we're somewhat better in the United States with mosquito control than they are in other areas. I know if you've ever been to the Caribbean or anywhere where it's tropical, there's any kind of standing water, you get bitten pretty easily there.
Yeah, my wife and I would bring the kids, and we would go, to Jamaica or the Caribbean, etc. And back in, you never even thought of that, never thought about, anything like that other than the water. Like we went to Acapulco, make sure that, the water is whatever. But not to be concerned where you really have to be looking at where you're going these days and what is happening in that area.
Right.
It becomes a challenge.
Yeah, absolutely. And then importantly, when you return too, if you do have any symptoms or issues, that you get checked.
If you've been infected, okay, is there a test?
There is. It's best if it's done within like the first 8 weeks, they think, maybe even 10. The problem is if it's done after that, we can detect antibodies, but we don't know for sure, is that Zika or is that dengue or something else?
Okay, before I go to break, so I go to the foreign country, or I'm in the Caribbean or these areas where there's a high rate of Zika viruses. I come back and I'm pregnant, okay, should I get a test?
Yes,
okay.
Absolutely.
All right. So that should be definitely. So does this affect future pregnancies?
We hope not.
Is there any test, any criteria on that?
Yeah, we think the good thing with Zika is once you've had it, we think you're immune.
Okay.
So hopefully, if a woman had Zika in a previous pregnancy and she gets pregnant again, she's immune. She won't have a problem.
The word is you think.
We think. There's a lot of research going on.
A lot of research. Folks, I'm talking to Michelle Kowalski. As you can tell, folks, it's always a challenge when you're doing some kind of traveling, but to keep yourself healthy, and that's why Michelle is where she's at, Occupational Health Services. And for those people who would like to have Michelle come to your place of operation to discuss preventative things of how you can keep your people healthy, 501-6600 is the number, 570. We'll be back right after these messages. Sam Lesante Show, folks, 501-6600. That's a number I want you to write down, 570-501-6600. And I'll tell you why. Dr. Kowalski's here today. She's from the Occupational Health Services at the Hazelton Wellness Center at Hazelton, and we'll be at the Mountaintop. So for those who are watching us Mountaintop, you can call the Mountaintop facility. A travel medicine. If I'm traveling, okay, that's why I said write the number down. It's best to get a consultation, give you a call and say, look, Michelle, I'm traveling to such and such, or, you should consult with you, correct?
Yeah, absolutely. Ideally, 2 months or more before you go, because some of the vaccines take time to work, for you to build antibodies to them. Also, you want to maximize your own health before you're there. So, if you have diabetes, high blood pressure, make sure that's under control. Any sort of musculoskeletal things, address those before you go. But then, we would want to see you, see where you're going. Again, look at those risks, which can change every day.
That's excellent. That is absolutely excellent. You know why? If I'm planning, if I'm planning to go anywhere over, in a different country, I don't know, number one, what kind of illnesses or medicine I may need when I'm there, what I can get. but also what kind of condition should I be physically if I'm going to do, like, am I going to do mountain climbing? Am I going to do tours? Am I going to do... This is interesting because now you can say, well, if you're going to do this and you have high blood pressure, if you do this, you have diabetes. Is that where we're going here?
Right, absolutely. And that ties back to what you said about the job. It's kind of the same thing. You know, you need to look, okay, what is this person going to be doing? And are they healthy enough to do it? If they aren't, can we make them healthier, or can we modify what they do or where they're going a little bit so that, you know, it fits, so that that person won't get any sicker with that activity, and things will go well.
And here is even the better part, which I love about Lehigh Valley Health Network. So let's assume I have a doctor in the system, okay? And so I come to you and say, you know, Michelle, I'm going to Italy for 3 weeks in 2 months, or I'm going to Europe, or I'm going to South America, or I'm going to whatever. You have access to my health records. Could you have access to my health records?
Yes, if your doctor's within the system, absolutely.
See, this is fabulous.
Even if they're not, that's part of what we do, is coordinate your care with your primary doc. Certainly everybody should have a primary doc, but they don't have the time sometimes to address prevention, and that's where we come in, whether it's travel or work or whatever else. You know, we work with your doctor to make you healthy.
I just think this is absolutely fantastic. You should be busy all the time.
I'm busy most of the time.
Yeah, no, seriously, because I think anyone who is doing any kind of travel, particularly if they know they're going to be somewhere in you know, summer, winter, fall, or whatever, okay, some people go skiing, okay, and they Switzerland or whatever, the Alps or whatever, and, you know, how's your heart condition, how's your this, how's your that, so you could give me an assessment of what to expect when I'm there and what I should be doing when I'm there.
Right, you mentioned skiing. Altitude is an issue. You know, there's certain medicines you can take to prevent altitude sickness, or things you can do. So yeah, there's always something that, you know, we can help you with wherever you're traveling.
So you actually come in there and you could tailor make my itinerary, and to be as a health issue, okay, particularly if I'm taking pills or if I'm taking any kind of medicine. You could give me my guideline as to what to do and some safety tips, etc. I just think this is great.
Yeah, we enjoy it. I've met some awesome people. It's amazing the trips they take. It's really, it's my benefit to hear about them. I get to live vicariously.
But you see, Michelle, you would never think of that. You know, when people are traveling today, I'm glad, you know, Lisa and Tammy had come on the show, because you would never think if I'm going to travel, should I call Occupational Health Services, talk to Michelle Kowalski and say, Michelle, listen, I'm traveling here, etc. I mean, you never would think of that.
Right, yeah, and
travel agencies should suggest that.
We have worked with a few of them, but yeah, and again, we've talked about the Zika has really highlighted that you have to look where you're going, but not that you shouldn't go. I think Mark Twain said, the world is like a book, and if you don't travel, you only read one page. So people should still travel.
Very good. Michelle Kowalski, folks, if you're traveling, kids, whatever it does, it affects everybody. Give her a call, 570-501-6600. Keep yourself safe, and believe me, this is a great opportunity for you to know exactly what to expect, what you need to bring, and to keep yourself healthy and enjoy your trip. We'll see you next time.